Still watching Morning Live. The Eastern Cape's biggest walk for cancer takes place in Port Elizabeth today. Over 15,000 people are walking 5 kilometers dressed in pink to raise funds and awareness for cancer. This year marks the 20th year of the walk, and SABC News reporter Leigh Paulse is at the event, and we say a very good morning to you, Jade. We're seeing very excited people there behind you. It is a cancer walk, a walk for a good cause.
That's very true, Paul. There's a sense of euphoria here in Nelson Mandela Bay where a lot of people have come out to support the cancer walk. As you would know, the statistics in South Africa speaks of 100,000 people that are, diagnosed annually with cancer. So people are really standing in solidarity with the many family members who have been detected with cancer, and also those who are indirectly and directly affected by the disease. But Paul, I am joined by the MEC of Health, Ms. Helen August-Sauls, and she's going to be explaining the role of the department within the province as well, and also this auspicious occasion. Thank you so much for joining us, MEC. People have really turned out in their numbers to support this. This is one of the biggest cancer walks in South Africa. Speak to us about the importance of this walk.
Well, obviously we have to thank the community of the Eastern Cape, specifically Nelson Mandela Bay, for over the number of years, 20 years, coming out and supporting this walk, making sure that we continuously strive for awareness, raising the issue of screening, raising the issue of testing, raising the issue of people going for treatment, and also advocating for a more healthy lifestyle. So I think the importance here of mobilizing partnerships and continuously raising this awareness benefits the whole community of the Eastern Cape, and we are proud as the Eastern Cape to be associated with Radio Algoa and with all the partners this year. And once again, having more than 13,000 people here today, it's such an auspicious occasion.
And I think the importance of this occasion is also the funds that are going to be raised for a mobile screening clinic. Just talk to us about that as well, MEC.
Well, the Cancer Societies obviously have identified that our rural areas, in working together in partnership with the Department of Health, that we also need to have a far bigger outreach in those areas. So this year, the funds will go specifically for that mobile cancer service center, where they will be then targeting the rural areas. Most of our facilities, they are very small facilities, and they have to travel long distances to the bigger facilities, the primary healthcare facilities. I think this is one of those good legacy projects of any of these type that you would want to see going, that we know where the investment is going. So we are proud to be associated with cancer, working in partnership with the Department of Health in the Eastern Cape, and continuously every year just lifting the awareness and raising the stature of people knowing, having to know their status if they have cancer, going, testing, and then going on to putting them on the right medication.
And then just lastly, MEC, with regards to members of the general public who are watching this, where can they go for screening, especially those in the rural areas that are close to town, and then also those that are in the urban areas? Where can they go just to seek advice?
Well, the first thing that we encourage with this awareness and everywhere where we are going is go to your nearest primary healthcare facility. Go and ask the sister, the operational managers in charge, that you want to do a pap smear. We're advising all women to go out there and to do annual pap smears, obviously. Even the men, because this year we want to start profiling. We've gotten into the stage now where we understand that we need to get men to go and be tested. Men can get cancer from breast, they can get prostate cancer, so we need to also raise. So all of our primary healthcare facilities are geared up for the pap smears, but then our bigger facilities obviously also have the necessary equipment to do further testing. So all of our facilities, they must just go there. We encourage them, go out there, first be screened and be tested, and then they will make that diagnosis. It's unfortunate that people are sitting, and when they do come to our facilities, they come already in the third stage of cancer, and then it is very late at that stage. So we want to stop the scourge of cancer that is killing women and men who get treatment at a very late stage.
Thank you so much, MEC. Well, there you have it, Pearl, the MEC for Health in the Eastern Cape, Ms. Helen August-Sauls, talking about the importance of this walk, but also talking about the importance of that screening, the mobile clinic that will be going to the rural areas of the Eastern Cape province, and also urging the general public to go out and get tested. I can tell you that Port Elizabeth is a sea of pink. I am also donned in pink. The men have also come out in the numbers wearing pink, so it's very nice to see the gentlemen also standing in solidarity with the women. But we'll bring you the latest in our next crossing and speak to some of the people on the floor. It's back to you in studio.
Our reporter Leigh Paulse coming to us live from the Nelson Mandela Bay, where that pink big cancer walk is taking place, and of course we'll hopefully cross back to her later on in the morning as she keeps us updated as per the day's events.